Senator Waters.
Thank you, Chair. Hello, folks. I've just got some questions about the National Framework for Maternity Services and its predecessor, the National Maternity Services Plan. Do we have the right folk here for those questions? Great, thank you. Can I ask about the plan first? Was there ever an evaluation or a review done of that plan?
I'll start off and then I might ask Ms Cole to help me with this. The National Maternity Services Plan, as you're probably aware, Senator, concluded on 30th of June 2016. There was a working group that was collecting information and analysis of how each of the jurisdictions were going against the various goals and targets that had been set under that framework. In April last year, the Australian Health Ministers, and they oversee this framework, they agreed to continue to work together to further improve maternity services through the development of an enduring national framework for maternity services rather than a plan that had a beginning and an ending. And that framework will consider potential inclusion of neonatal, child health services, antenatal health risk factors and screening for family violence. So that's the unfolding scope for that. The development of the framework is being led by Queensland. The Commonwealth is involved in that as one of 9 jurisdictions. A draft of the framework was available for public consultation between the 21st of March and 18th of April this year. And as I understand, that working group is progressing through analysis of those submissions, and that will be considered through the RMAC and COAG Health Council process by the end of this year.
Okay, thanks for that background, and I do want to come back to a few more detailed questions about the framework.
Sure.
But can I just start off with the plan first, which, as you pointed out, has now expired. There was a commitment under that plan that a formal evaluation would take place during Year 5, which would make recommendations for future actions. Was that done?
I might just ask Ms Cole to...
Senator, there was a final report which was done and which is available on our website and also the RMAC website.
Sorry, could you say that again?
There's a final report on the plan, so there were pretty much yearly reports, annual reports, which described the actions taken by jurisdictions in response to the plan. And then there was a final report which was done at the end, obviously, of the 5 years, and that's currently available on our website and also the RMAC website.
Okay, so was that an evaluation as such?
I'll just check with my colleague. Not a formal evaluation. Yeah,
what was it then?
Sort of a summation of all the activities.
There's an agreed set of actions over the life of that plan, and there was a small secretariat that asked each jurisdiction to provide regular update reports. So in a sense it was a sort of an evaluation of what they said they were going to implement. I don't think it would meet the criteria of an impact evaluation, but it certainly was more process orientated.
Okay, I understand, thank you. So given the original commitment in the plan itself that there would be an evaluation which would include review of achievements and outcomes and recommendations for future actions, who took the decision not to do that more fulsome evaluation, and when was that taken?
I'm not quite sure that a conscious decision has been taken not to do that. I think it's possibly an interpretation of what's meant by an evaluation that can mean many things to many people, but this is not something the Commonwealth is leading. We're certainly participating in, and what I think the best thing we can do, Senator, is we can check with the Queensland lead on this and the RMAC Secretariat to clarify the specific question that you asked. Okay. I don't recall a conscious decision to not evaluate. I suspect it's the way it's been.
It just didn't happen. Okay.
Or the way it's been done.
Thank you for taking that on notice and following up those other folk. I'll look forward to that response. Moving now to the development of the National Maternity Services Framework, which you started to take me through earlier. Who's leading the development of that? You said Queensland was...
Queensland, yeah.
Are there any private consulting firms being engaged as well?
I will need to... yes, Deloitte Touche Tomatsu or Deloitte have been engaged to develop the framework.
Okay, can I ask why that is?
It's not uncommon.
Outsourced?
So it's not uncommon when you've got a large-scale piece of policy work involving multiple jurisdictions to, I guess, to contract specific expertise for parts or all of the work. That's a very common approach we use for a lot of national policy development.
All right. Is there not the expertise within the department to do the work?
Well, just to make it clear, this is not the department's framework. It's a framework that's being developed by under the auspice of COAG Health Council. We have some expertise to contribute to this, but as with any policy development work, we engage specialised stakeholders from the different stakeholder groups, and could be universities, colleges, etc. And we would also engage advisory groups such as Deloitte to assist us with the rapid conduct of that piece of work. So it's just the way that business is done. Okay.
So you mentioned key stakeholders there. Can I ask what consultation has been undertaken with which key stakeholders in the development of that framework?
Look, a number of stakeholder groups have been consulted, but I think you're getting to the question of the AMA. Is that right? AMA, and whether they were happy with the process or not?
Just interested in the breadth of who's been consulted, not necessarily the AMA, but that's good to know.
My understanding, and I don't actually have the full details in front of me, that there was a consultative process set up that involved public and private healthcare providers and a number of professional groups. Mm-hmm. We are aware that the AMA and the National Association of Specialist Obstetricians and Gynaecologists had expressed some concerns about the level of representation in the working group. Queensland has taken that on board. They've admitted that at least one group, the AMA, was omitted from the initial consultation, and I understand they've taken steps to rectify that. So I'm certainly aware that there was some concern, and I think Maternity Choices Australia has also written to the Queensland Health Minister just seeking some further advice about the way this has been undertaken. And I understand that Queensland Health, as the lead institution, is following up on those concerns that have been raised. I'm not specifically aware of the nature and detail of the concerns they've raised, other that concerns have been raised about whether the consultation process is inclusive as it should be, and I think Queensland Health is responding to that. Okay.
Well, if you could possibly take on notice for me to check on the list of folk who were consulted.
Certainly will.
Thank you, that'd be great. And an associated question is whether or not consumers of maternity services have been consulted.
I'll take that on board.
Okay. And just wrapping up, because I know we're very tight on time, will the new framework include the provision for public reporting of data? Either from the hospitals themselves, as well as progress under the plan's various objectives? I can't answer that question because the framework hasn't been settled. It'll be considered through the RMAC and COAG Health Council process towards the end of the year, but we're happy to take that on notice, Senator, and provide you with advice as to whether that's part of the process. I've got a couple of more questions, but I'll put them on notice in the interest of time. Thanks for your help.
Excellent. Thank you very much.